what I'm curious about is how this molecule also can be a therapeutic molecule, not just sort of a preventive molecule that deals with some of these basic mechanisms, but how could it affect, your treatment of diabetes or heart disease or fatty liver disease? How does that work?
And that's where it gets to, conveniently, like longevity molecule must have number, what are we on, 4, clinically relevant benefits within months. If a molecule says, hey, we target these mechanisms of longevity, but you're not really going to see anything, but you'll live longer, that doesn't, for Nick and I, that just is not what we were looking for. We're looking for to say, can C15 actually have meaningful benefits, specifically with people with diseases? So again, caveating that as a supplement, supplements aren't intended to treat or prevent or to treat diseases. But we're talking about the studies that have been done to date and what we're seeing, that, we need C15, and putting C15 back into our system and optimizing those levels. We are seeing disease treating effects. And this is both in people. So let's take, for example, a clinical trial with Dr. Jeff Schwimmer, fatty liver disease, right? So that didn't exist. Non-alcoholic fatty liver disease, are now MAFLD.
They changed the name because
a
you used to only see this fatty liver issues in alcoholics.
That's right.
And now the most prevalent form is those with metabolic dysfunction, meaning diabetes, prediabetes, and they call it metabolic associated fatty liver disease.
Maybe us docs and scientists should be involved in branding a disease name. So
MAFLD as opposed to NAFLD.
so there you go. So I'll call it fatty liver disease, not associated with alcohol. So, that wasn't known until Mayo Clinic published a paper in 1980 for the first 20 cases. And then, so since then, we fast forward to today, the latest paper showed 38% of people globally have fatty liver disease. So this has been a alarming rise in people with fatty liver disease, a percentage of which are progressed to steatohepatitis, inflammation, cirrhosis, becoming one of the leading causes of liver transplants and liver cancer.
Yeah. This is important. What you said was really important because, about 1 in 10 or less, the 1 in 9 now keeps getting worse in America, have diabetes, type 2 diabetes. But what you're saying is 4 in 10, almost 4 in 10 have fatty liver disease. Even if you don't have diabetes, it still increases your risk of heart attacks, cancer, stroke, rapid aging, and death.
That's right. Now, none of we don't want any of those.
Even if you don't have diabetes.
That's right.
Right.
That's right.
So it's important, and it's often not diagnosed. It's often missed. There are now really great blood tests you can do to find out if you have it, not just your regular liver function test. And we offer these as part of Function Health's testing. So you can go to functionhealth.com/mark and actually get these tests as add-on tests to the basic function panel that look at fibrosis in the liver and are really helpful to kind of pick up people who have this, because you don't want to continue to have this if you have it. I mean, you can diagnose it through an MRI or various kinds of fancy testing, but through a simple blood test, you can also kind of get a pretty good idea. And it's important to understand because this is a silent epidemic that nobody ever heard of, and it doesn't really have a ton of symptoms other than, maybe you're overweight and maybe you got a big belly or maybe but it's quite important. And so what you're saying is that C15 has the potential to impact fatty liver disease.
Yeah, exactly. And so when Jeff Schwimmer is a leader in pediatric fatty liver disease, and he opened the first clinic for fatty liver disease for kids. And so Jeff, back in 2012, had published a paper on fatty liver disease in dolphins. And he sent me an email, and he's like, it's probably not what we're seeing in people. Like, it's probably not the same disease, but send me some liver slides that you have, and let me get back to you. So I sent
These were dolphins who died, and then you found it, right?
Exactly. Yeah. Dolphins who had, exactly. And then afterward we had found...
You're not like sacrificing dolphins to get the tissue specimens. Yeah. It's not like they do mice, right?
Thank you for that clarification. Yeah, we're actually able to go back and look at pathophysiology reports of dolphins that had passed. So we had this... That was another amazing archive, right, of information. So we were able to send those slides to Jeff, and then a couple weeks later, Mark, I got an email, and the title was "We Are All Go." He's like, "This is the exact same presentation of fatty liver disease that you're seeing in dolphins that I'm seeing in my kids." And he's like, you're blowing my mind because dolphins don't eat sugar. They're
Yeah.
not eating trans fats. It's not ultra processed
Yeah,
foods.
that's what I'm wondering.
Right? And it's just like, what? And so that started our 10-year journey in which we have worked together, but independently. That Jeff then did a study in which he looked at 237 kids. And he did, at the time, they didn't have your wonderful test, which everybody should get the test that Mark just mentioned to assess your liver, regardless of who you are and your age.
Yeah.
Everybody
Yeah,
should
yeah.
get this test. So Jeff did this study, and he looked at these kids, and he showed that the higher their C15 was correlated with lower liver fat. And this was a linear correlation. So the higher the C15, the lower the fat in the liver. So he's like, okay, well, that's interesting. So then that resulted in him doing a randomized placebo-controlled clinical trial with fatty 15, with C15 supplementation among young adults who were graduates who had a history of fatty liver disease.
Wow.
And what he found, there were really key important things that happened that he found. The first is he found that 2 out of 3 of the people in his study had the definition of a C15 deficiency. 2/3. So if you have fatty liver disease, yeah, you had an even higher risk of what we were saying the general population has.
1 in 3 to 2 and 3.
Yeah, exactly. And then for the people who took C15 supplementation and got their blood levels above that threshold of deficiency, they had lower liver enzymes, lower ALT, lower AST, and improved red blood cell health within 12 weeks. So now the leading hypothesis and what we have found in the dolphins is that nutritional C15 deficiencies may actually be the cause, or at least one cause, of a substantial phenotype of fatty liver. Because why did it show up? Why did this show up all of a sudden and affect so many? So that is obviously raises
because sugar and
urgency.
starch is a massive
That
part of
too.
our diet, and I think it's probably, in my view, a combination of the increase in sugar and starch plus
The
the
C15.
C15 deficiency, right?
Yeah, and for us, we keep going back to the dolphins, and for the we call this the dolphin phenotype of fatty liver disease. The only change they had moved to they were eating a high fat fish called eulicon, which is called a candlefish. It has so much fat in it that you can stick a wick in it. You could dry it, stick a wick in it, and be a candle.
Yeah.
That fishery died out in the 1990s.
Yeah.
And so that's when they moved to this lower fat capelin. And so at the same time that humans, we were moving away from whole fat dairy and our C15 sources, the dolphins were going on a low C15 diet,
Yeah.
and fatty liver disease pops up.
Fascinating. Well, the Native Americans, you might not know this story, but the Native Americans used to trade in these really highly fatty little tiny fish as
That's
part
right.
of their trade. So if you were a Pacific Northwest Native American, and you would trade with inland tribes and use the fish as your currency. So instead of dollars, you'd give them fish, and they'd give you beads or whatever else they wanted. So that's fascinating because it was such a valuable commodity back then.
Yeah, and now we understand even more so, how valuable that was. So that kind of, as far as we also know that C15.
Well, that's a human trial. It seemed to be.
That's right. Yeah.
really
And so
impressive.
that was
And
published last year.
directionally showed what's possible. Like, it didn't cure their fatty liver disease, but it seemed to sort of create a downward trend in the effects. And you still have to cut out the sugar and starch.
Yeah, we need to look at the whole picture of lifestyles and how we're changing things. What's interesting is it really goes against the whole idea of all saturated fats
Are bad.
and that
Yeah.
we have one that's essential. So it's how do we get it back into our diet?
Yeah.
So there's a lot of you could feel the urgency around this movement. The reason for the book is really to help increase education, and let's have the conversations around. We can't explain it away anymore. So
And what kind of studies have there been in humans around diabetes, type 2 diabetes, and heart disease? Is anything?
So with regard to, there was a second study in Singapore, and that's one I had mentioned. That was also fatty liver disease, women with fatty liver disease, and it showed that it lowered LDL cholesterol and then improved the gut microbiome. That was an interesting study because that what they did for this clinical trial, and this was also a controlled clinical trial, that they had the control group was one that went on a hypocaloric diet. So they had they had an average
low-calorie diet.
Yeah, exactly, like 1,000 calories per day. That'd be tough to sustain. That was the first group. The second group was a low-calorie plus Mediterranean guidelines, which both of those have been shown to help with fatty liver disease metabolism and various components.
Ketogenic diet works best.
Even better. You're spot on. And then the third was low-calorie Mediterranean plus C15 supplementation. So it was a big lift to ask of C15. In those groups, not only did the third group, the C15 supplementation, result in lower LDL cholesterol and improved gut microbiome, but it also had the greatest loss of liver fat, the greatest loss of body fat, the greatest glucose improvements, but it was trending. It was not statistically significant. You just kind of saw the step. But again, it was 12 weeks.
Yeah.
And so the question is dosing, timing, things like that. In numerous studies of these meta-analyses, right? Studies of studies that prospectively follow thousands of people over decades, numerous studies have consistently shown people with higher C15, just like we saw in the dolphins, lower risk of developing type 2 diabetes, of heart disease, specifically coronary heart disease, of developing fatty liver disease and certain types of cancers, specifically a lot of work on colorectal cancer. This is why with all these different aspects of the data, from epidemiological data, clinical trials, mechanisms of action, in vivo efficacy studies, this is why Dr. Nick Shork, who was at ARDD, which is one of the world's leading anti-aging therapeutics meetings, he was in Copenhagen last year, and he presented C15. He said, listen, I've seen every longevity molecule under the sun, and I've not seen a molecule that has more supportive data of being a longevity enhancing molecule than C15.
If you love that last video, you're going to love the next one. Check it out here.